good. Then there is Atul Mohan will speak on 15% TCA peeling in Acanthosis nigricans. Atul Mohan.
Good afternoon, everyone. Today I am going to present my short topic or 15% TGP in patients of acanthosis nigricans. As we know, acanthosis nigricans was proposed by Una, which was derived from acanthos, which means thorn in Greek, and nigricans, which is derived from Latin word black. Acanthosis nigricans is a common pigmented disorder characterized with hyperpigmented velvety thickening of skin. It usually affects flexural area but can affect any part of the body, as most commonly affect the posterior part of the neck, axilla, groin, antecubital fossa, and umbilical area. Kurt divided acanthosis nigricans in 4 types, which is the most common type, pseudoacanthosis nigricans, which is usually associated with metabolic syndrome or obesity. Second is benign acanthosis nigricans, which is usually found in the children, have familial predisposition and associated with the autosomal dominant inheritance. Third is which is the most common type of the most important type of the acanthosis nigricans, that is malignant acanthosis nigricans, usually associated with the GI cancer. So it usually presents with florid presentation as acanthosis nigricans of the palm pores and oral cavity as well. And last is the syndromic acanthosis nigricans, which is associated with the hair syndrome or autonomic nervous system, autoimmune disorders. The etiology usually involves the insulin resistance, which causes the higher concentration of the insulin, and insulin-like growth factor receptor resistance as well, which leads to the stimulation of the keratinocyte and fibroblasts, and increased level of the tumor growth factor and epidermal growth factor. Drugs are also associated with the acanthosis nigricans, including corticosteroid, nicotinic acid, insulin, OCPs, and fusidic acids. There is one case report which shows topical fusidic acid causes acanthosis nigricans. This is the scoring system for the acanthosis nigricans, which shows the neck texture score, which is graded from the 0, 1, 2, 3, 4. 0, there is no acanthosis nigricans, skin was normal. First is skin will be rough to touch, it will be differentiated from the normal skin. And second is the skin will feel cold, it will be clearly visible hyperpigmented area over the affected area. And third is the extremely cold, hilly and welly appearance. The trichloroacetic acid, which is 50%, is a superficial exfoliative agent, causes the destruction of the epidermis and subsequent repair and rejuvenation. It is a caustic agent causing the coagulation of the skin protein and leading to frosting. Frosting usually appear if we using concentration more than 15%. It causes precipitation of the proteins leading to necrosis and destruction of the epidermis, followed by inflammation and activation of the wound repair mechanism, leading to the extraction and the replacement of the smooth spot. So my aim was to see the safety and efficacy of the 15% TCA peel in patients of acanthosis nigricans. It was done over a short period of 5 months, and case series was done. So by clinically diagnosing the patient with more than 18 years of age who was willing to give informed consent. Exclusion criteria was like there was hypersensitivity to the TCA peel or fluoride tendency, or the patient was lactating or female, active infection of the site, or any other chronic diseases. So steps of the procedure was priming was done initially in the first visit with sunscreen more than SPF more than 30, with 2 weeks prior to the first field session, and pre-post-auricular field test was done to check for the hypersensitivity. And the first site was cleaned with sterilium and acetone to decrease the size, and 15% TCP was applied using brush in a single pass, and feathering was done at the edges to avoid the demarcation line. Endpoint was seen as a patient presence of the diffuse skin erythema with cloudy frosting, white frosting. It was not diffuse frosting, it was just cloudy white frosting that usually disappears in 10 to 15 minutes, and later on the area was cleaned with cold water. These are the materials required during the cleaning procedure. Followed by patient was asked to apply the sunscreen and regularly follow up at a 2-week session for a total of 4 sessions, and last follow up was done at the 4 weeks after the last session. Degree of improvement in pigmentation was measured as a minimal, moderate, good and excellent improvement. These are the results of my case series. Total 10 patients was included, but one patient was not came for the follow-up after first visit. Male to female ratio was 1:4. Mean age was 33.5 years. Mean BMI was 24.45 years, which varies from the 23 to 28. Mean duration of the disease was 3.2 years. Fitzpatrick skin type was 4 and 5. Acrocodons were seen in 3 patients. And side effects like immediate burn, mild burning was seen in all patients, and 3 patients saw mild desquamation in the first week, which improved by itself. And the neck texture score was recorded in the first visit, and grade 1 was seen in the 2 patients, grade 2 in 6 patients, and grade 3 in 2 patients. Grade of improvement in pigmentation was recorded as a minimal, moderate, good, excellent improvement. One patient showed a minimal improvement, that is 0 to 25% improvement. 5 patients showed 26 to 50% improvement, and 3 patients showed 51 to 70% improvement, 75% improvement. First, 1 patient was lost to follow. This is the first patient, 35-year female patient, the total duration of illness for the cancer Aesthetica as a 5 years, and there was 4 sessions was done, and the patient shows a good improvement in lesions of acanthosis Aesthetica. This is another female patient who also showed a good improvement, and this is a female patient who showed only moderate improvement in after 4 sessions of the period. And this is a young male patient who presented with acanthosis Aesthetica. As she's seen this picture, lower below, mild scaling is seen even after 2 weeks of the last session. Discussion. As a TCA is a chemical that causes keratolysis and protein denaturation that results in white sauce-like appearance called keratocoagulation. Superficial injury as a desired target of lower concentration of the TCA, that is less than 15% concentration, characterizes the presence of diffuse erythema and light cloudy white flushing. TCA is a stable product, so we can use it for a longer duration, and shelf life will increase, and it will not cause any systemic absorption. That's why I use PCAP, and easily available, affordable, and easy to prepare. This is a single RCT which compares the efficacy 15% TCAP with topical tetramethyl 0.025%. In that RCT, moderate improvement, that is 50 to 75% improvement was seen in 17 patients out of 25 patients. And only 10 patients out of 25 patients showed improvement in the TCP. Conclusion: 15% TCP can be considered as a good treatment option for the cancers and inheritance, with good efficacy in most cases without any serious side effects. Initial first, good priming along with pre and post procedure care is very important to avoid the side effects. These are my references. And in cases of the cancers and inheritance, it is very important to reduce weight and follow healthy lifestyle. Thank you.
Thank you for your attention. Thank you for the nice talk. And any questions?
As there is no question, before proceed to the next speaker, Dr. Kamalpreet Kaur. She will speak on the role of oral topicet in alopecia. This is the last speaker of the day. If anybody else is interested in presenting something, may come forward over here.
Good afternoon, everyone. Today I'm going to throw some light on oral tofacitinib in alopecia areata, and everybody is familiar with this. Alopecia areata is a non-scarring alopecia that presents with well-demarcated patches of hair loss, and in this there is autoimmune destruction of hair follicles by CD8 T cells, and it affects all age groups. Over the time, multiple treatments have been evolved with variable results. Tofacitinib is a JAK1 and 3 inhibitor approved earlier for the treatment of rheumatoid arthritis, but has been off-label used in alopecia areata. Objective of this case series was to evaluate retrospectively the clinical outcome of patients with alopecia areata treated with oral tofacitinib who have not been responding with the conventional treatments given for alopecia areata. 6 patients were included and they were started with 5 mg twice daily dose. In some patients, need for biotin supplements was required along with topical PUA therapy, and treatment response and adverse events were collected from patients' previous prescription records after taking their consent. 6 patients in between the age group of 10 to 35 years were identified with the disease with the mean duration of 6.67 months, and they were advised 5 mg twice daily dose for 6 to 8 months according to the patient's response. The mean time for first response was 1.5 months, and 4 patients experienced good hair regrowth with the oral tofacitinib, while 2 patients experienced minimal to no hair growth, and only adverse event observed was raised triglyceride level in 1 adult patient in 3rd follow-up visit. This is the table summarizing the results. And in this, we lost one follow-up of the patient who was having alopecia totalis, and the girl didn't respond to conventional treatment. So we started 5 mg. We started with 5 mg OD single dose, and in the second visit, as the drug was well tolerated by the patient, so we gradually increased the dose. In third visit, the child showed minimal hair growth, and after that, we lost the follow-up of that patient. And rest other patients showed good response. This is the image showing the ophiasis pattern, and after 3 months of treatment, good hair regrowth was visible. This is the child, female patient which we lost the follow-up. Hence, our results suggest that oral tofacitinib may be an effective option for patients with alopecia areata who did not respond to conventional treatments. Most patients noticed at least mild regrowth within the first month of therapy, but some required more time to see the significant growth. The study conducted by Cheng et al. Noticed mild regrowth, mild hair regrowth within first 3 months, and in some patients, and some required more time for visible hair regrowth, which was comparable to this case series. This case series also showed that medication was well tolerated by the patients, while there is increased risk of serious infection and malignancy with high dose of oral tofacitinib. At last, it can be concluded that oral tofacitinib can be a promising treatment option for patients with refractory alopecia areata, but additional studies are necessary to evaluate the safety and durability of response after stopping the JAK inhibitor treatment. And the take-home message is that JAK inhibitors are effective, but how much effective they are in the treatment of refractory alopecia areata is need to be evaluated, because as they if we come to the pathogenesis, they inhibit the means they cause decreases the interleukin 15, which is involved in the pathogenesis of alopecia areata, which is responsible for the more production of the cytokines and inflammatory cells like T lymphocytes, plasma cells, dendritic cell, mast cells, which is responsible for the swarm of bees appearance in the histopathology. But apart from that, it also blocks the interleukin 10, which is the good interleukin and protects the cells from the autoimmunity. But tofacitinib has a role in decreasing interleukin 10, so if we use for prolonged period, it can also lead to the autoimmunity against the hair follicles. It can worsen the autoimmunity, and it has been mentioned in one article, the Lancet article, which I mentioned in my fourth reference. Thank you.
Thank you for your attention. Any questions? Nice presentation.
So thanks for the last speaker. There's nobody else. Now I think we can straight away go into valedictory. Stand there, okay. Okay then. You heard about Aesthetic Asia, you have come to present papers, I understand, and many people have come to visit Vishwanath. So this is a part of the game. We enjoy, we become tourists, we attend scientific session, learn something, go home, and share the knowledge with the patient in the form of prescription. What happens to these places? These places are places where you learn easily. No exam to give, nothing. The specialists or the experts come, deliver the lecture, so that we can learn from each other. See, together we learn. That is our main logo. So it's not that you are learning, it's we are also learning. We are updating ourselves. Now, how this organization was formed. I retired myself as a professor at HOD in the Department of Dermatology in Institute of Postgraduate Medical Education and Research, Kolkata. After retirement, I don't know what to do. I was in practice, I do practice, but practice is secondary for me at this age. Okay. There are a group of patients who come to me, new patients come, etc., that's it. But I don't have that passion to move forward. So I thought that we can form an organization where people can come together, learn something from each other. Together we learn how to do it. Then it came into my mind to form an association. The name of the association is the Eastern India Cosmetic Dermatology Research Academy. This one. Initially thought that the upcoming students are doctors, young doctors, they want to present papers, they don't know what to do. Most of the time in the All India Forum, they got rejected. So they should get a platform where they can express themselves. We started that way. And our annual conference, the name of the annual conference is Aesthetica Asia. The first year we did it in 2016 in Grand Hotel, Kolkata. 3 foreign speakers were there. People from Bangladesh, Nepal, and other places had come. It was a grand conference. The opening was grand. So the first was fantastic. The second one was held in Port Blair, Andaman, where we had around 400 delegates. The reason is not aggregation. The reason is they could visit that place and they liked it. The third one was, where is Dinesh gone?
Jaipur.
Where is Dinesh?
Jaipur.
Where is Dinesh Mathur? I'm asking that. That was Dinesh's place. He organized the whole thing and it was also fantastic. After that we moved to a place called Gangtok, the capital of Sikkim. The best hotel there, I forget the name, we had it there. That also was very nice. And then the COVID came. We were stuck. We had to do something. So we had a conference in Mumbai in a hybrid form. So very few people were there and it was in a hybrid form and most of them participated from their own home. And the number of delegates were about 1,200. After that, when the COVID was over, we had this physical forum again, and that place was
Kaziranga.
Kaziranga. Have you gone to Kaziranga, anybody over here? Oh, only 3-4 people. It's a nice place in Assam. So you can see a lot of animals in a very cozy, natural surroundings. And after Kaziranga, we are here. Hey, so this one is the last. I hope you have liked it. And what are the challenges in organizing such an event? Challenges are many, many, many. People do come, do the presentation, they go home. Very few people volunteer. I want the young people to come and take over this organization and institution so that it can go on. I am 76. Now I think I should hand over. I need people, active people, who wants to take over this. So it is up to you all to think if you are aggressive enough, confident enough, just judo hamare saath, so that we take the thing along in future. The takeaway message in this conference, there are plenty. One is you learn whatever you learn from here. Suppose during a presentation you go out and you come, from the about 50 presentation, we have heard about 12 or maybe 18, maybe 25. But once you sit over here, you learn. And you take those information in the form of prescription, you are using your experience. That is the main take-home message from this. Now I would request all who are present over here to say something about the conference. Is there anybody? Dr. Shiva sir. Oh, he is. Dr. Varna has come. 1 minute. Okay. After that you can talk. So you can take this one also. No,
Okay, fine.
Oh.
I would was fantastic again. It was fantastic again. Fantastic, it was fantastic, it was perfect, it was fantastic. And I traveled 20 hours ago, and I have no regret. So a good congress is a congress where people are meeting each other. And what's even more important is that we meet each other over the borders, over the world, because I learned a lot of things during this congress. And for me, a good congress is when I change one thing in my daily practice. That's a very good congress. If I change 2 or 3 things, it's a marvelous congress. And I will change 3 things in my practice. So thank you very much for this nice organization.
Thank you, Dr. Barnard Killier. He has come from Brussels, Belgium. This is the second time he is visiting us. He was there in Kazakh. So we have become friends now. You two join and let us be friends. Dr. Srivastava.
सबसे पहले मैं अपने हृदय से आभार और धन्यवाद देना चाहता हूं दत्ता सर को, जिन्होंने एस्थेटिका एशिया के लिए वाराणसी जैसा पवित्र जगह को चुना जो है। यहाँ पर हम लोग काफ़ी डेलीगेट्स, स्पीकर्स, चेयरपर्सन, एम्प्लॉइज आए और दत्ता सर से जो प्रेरणा मिली, जैसे गुरु से प्रेरणा मिलती है, प्रकाश मिलता है, पथ मिलता है, एस्थेटिका एशिया के लिए हम लोगों को इतनी प्रेरणा, प्रकाश और मार्ग मिला कैसे एस्थेटिक फार्मास्यूटिकल कंपनियां भी सहयोग की, कैसे हम लोगों को एस्थेटिक सोसाइटी में और आगे डेवलप करना है। दत्ता साहब एक तरह से जैसे पानी तो चलता ही है पाइप में, लेकिन टुल्लू मशीन लगा देने से पानी बड़ी तेजी से खींचता है, औरों का भी खींच लेता है। हमारी दत्ता सर इस समय उसी तरह से एस्थेटिका एशिया के लिए काम कर रहे हैं। ये उस तरह के वोल्टेज टुल्लू मशीन है कि पानी इतनी तेजी से एस्थेटिका प्रोग्रेस कर रही है। हम 19 में गैंगटॉक में अटेंड किए थे एस्थेटिका एशिया को, इसके बाद हम आज अटेंड कर रहे हैं। और इन्होंने सब जितने डेलीगेट्स, स्पीकर्स, चेयरपर्सन, अदर फार्मास्यूटिकल कंपनीज, फॉरेनर्स जो डेलीगेट्स हमारे आए हुए हैं, सबको इन्होंने सम्मान भी दिया और सम्मान भी दिया। सब लोगों के दिल में उतर गए। कुछ लोग दिल से उतर जाते हैं, कुछ लोग दिल में उतर जाते हैं। तो दत्ता साहब ने जिस तरह से इस उम्र में इस मेहनत से और इतनी डायनिकता से काम कर रहे थे कि इनका कार्य बहुत ही सराहनीय है और इनके लिए आदरणीय ही दत्ता सर को कहा जा सकता है। साबुन बिना पानी के बेकार है। एस्थेटिका एशिया जो है, दत्ता सर जब तक रहेंगे इस तरह से पानी रहेंगे कि इसमें ऐसा झाग देगा जो बहुत तेजी से नाम करेगा एस्थेटिका एशिया और दिन पर दिन काफी प्रगति करता जाएगा। तो दत्ता साहब का मैं बहुत बहुत पुनः धन्यवाद देना चाहता हूं, जिन्होंने इतनी मेहनत से, इतना तरीके से और एक जबरदस्त उत्साह जिसको बोलते हैं इस उम्र में, उस उत्साह के साथ सबको में उत्साह भरा। और अभी तक जो लोग एस्थेटिका एशिया को बड़े, जब आदमी कोई चीज सीखता है नया तो वो बड़ा कस के हैंडल पकड़ना पड़ता है जब गाड़ी से चलाना सीखता है, और जब सीख जाता है तो वही गाड़ी एक उंगली से चलती है। तो हमारे दत्ता सर जो है अब इतने निपुण एस्थेटिका एशिया में है कि अब हम लोगों को एक उंगली से गाड़ी चलाना सिखाएंगे कुछ दिन। और सभी लोग दिन पर दिन इतने लोग इसमें जुड़ेंगे, वो टुल्लू वाटर पंप की तरह कि और ब्रांच के लोग भी एस्थेटिका में जुड़ने लगेंगे और दत्ता साहब के फिर जय जयकार होगी। इसी शब्दों से मैं अपने शब्द पर विराम देना चाहता हूं और दत्ता साहब को फिर पुनः धन्यवाद देना चाहता हूं, जिन्होंने इस वाराणसी पवित्र नगरी में इस तरह का प्रदर्शन किया। एस्थेटिका एशिया जो है, हर लोग इसकी चर्चा करते हुए यहाँ से गए और दत्ता जी सबके दिल में उतर गए। धन्यवाद।
धन्यवाद श्रीवास्तव साहब, मैं बहुत आभारी हूँ।
From the younger ones.
Dr. Vimla, you want to say something about the conference?
First of all, thank you for the invitation from Asia Aesthetica, because I've been a part of so many conferences, and this is something which is actively holding together the younger and the older generation, and both dermatology and aesthetic dermatology. I wouldn't call it as cosmetology, because that word is actually looking down upon us. We have so many other branches, people and beauticians and other physicians who are taking up aesthetic dermatology into their hands. So we should greatly collaborate with each other, teach the younger dermatologists aesthetic dermatology, and be proud to say that that we are actually the persons who have to practice aesthetic dermatology. Sir has clubbed up nicely both the aesthetic dermatology and the clinical dermatology very well. And inviting younger dermatologists is one thing which is going to help this to progress, and we would definitely support sir in every way possible. Thank you so much, sir.
Thank you. Yeah, that is my main intention. The young people should come up. And why I call the older people? They have the experience, they have the expertise, so that you can learn from them. That is the main thing. Dr. Rashmi? After that, Tulika should come and say something. And those were the back, young doctors, please come forward and say something about the conference, about yourself, and something like that. Come and participate. That is the main thing. You sit there like a doll. Does it work? Start.
First of all, I would like to thank Arindatta sir for making me a part of this conference, which was excellent part, and it was a combination of both aesthetics and dermatology. And again, I would like to thank all the delegates who have come here long way to Varanasi and be a part of this conference and help Aesthetica Asia grow. And as sir said, together we learn. So we have learned together a lot from day before and today and just yesterday. So thank you, sir. Thank you very much.
Thank you very much. Next, Tulika.
Thank you, sir, for choosing Varanasi to hold this conference. So you gave us the opportunity to present our work, and our residents also got the opportunity to present their research on this platform. And I would like to take a lot of inspiration from you, sir. And as you said, that together we learn. We had a good opportunity to learn from so many people, and especially from you, sir. Really thankful to you.
Thank you, but I have presented a paper on indigenous medicine, haldi, sodium carb and all this. So I don't know what you have learned from that. Anyway, but my reason of presenting those things in this platform is we should know our culture. We should know the benefits of the indigenous things which we have in our kitchen, and we can help with those. Haldi is a fantastic wonder drug. Ginger, long, elaichi, everything, jeera. You get this, what do you call it, gasofast with jeera. Why? Because jeera helps. There is this jal jeera. It helps your digestion. So these things are there, but we don't understand. Western people are making money out of it, and we are lying down over here and writing prescriptions which the West has endorsed. We should endorse our thing, and we should go forward for that. It works. Maybe someplace fast, maybe someplace slow, but it works. Just read these things and you'll understand. Anyway, anybody else to say something? Arey, bachcha log aa jao. Please, please. Now you all talk and decide who will represent you all and come over here.
I'm very thankful to Aesthetica Asia to allow me to present my presentation. I was very keen to present my work, and my residents also, my juniors also have presented. And sir, I thank you for holding this conference in Varanasi.
Thank you.
May I share my experience?
Huh? Anybody else?
May I?
Please come. He is Professor Prabhat Dotto. He is an adjunct professor in St. Xavier's University, Kolkata. A globetrotter, goes to different countries to give lectures on social aspects. He is not a doctor, but he has a doctorate. That's why his name is Dr. Prabhat Dotto. Please.
Thank you. I am indeed deeply grateful to Professor Anand Datta for having given me the privilege of joining him, coming over here and meeting a large number of experts on dermatology. I am a student of political science and I retired as the chair professor of the Department of Political Science, University of Calcutta. After having after having completed my term in the university, I have been very closely working with Professor Anand Datta. He is my guide, philosopher and friend. And when he had planned to come over here, I had also requested him that I would like to be with him on all these days, despite the fact that I have to offer an explanation to my father, Vice Chancellor, about where did you go, what have you been doing over the last 1 week. You didn't take classes in the university. But I wanted to interact with the doctors. I wanted to learn from you. And what I have learned over the last 3 days of interactions, I have been carefully listening. Terminology is unknown, words are unknown. The kind of talk that was being presented was touching me, but it could not enter into the head because the words are unknown. But I found that a lot of younger scholars came, presented papers, a lot of enthusiasm, and Professor Datta has tried his best to make sure that your stay is comfortable, you could make presentation. Therefore, I would like to appreciate the kind of initiative that Professor Datta has been taken over the last nearly a decade to carry on the research on dermatology and to bring in people from the country as well as from abroad, so that we can learn from each other. In fact, in our political science study, there is a slogan that learning cannot be an individual affair. Learning has to be a collective affair. Learning is a product of wisdom, where many people get together, interact, and this is what has taken place here. I am really grateful to all of you from whom I have learned little bit of what is called aesthetics, because that is, I think this is what everybody has to know about. And I have learned a little bit of it. Thank you for enriching my knowledge about how to make our health better in terms of Aesthetica. Thank you very much.
Thank you, Professor Dotto. आपने डिसाइड किया? Come, please. I'll tell you one thing, one small quotation. Life's battle do not always go to the greater or stronger man. Life's battle do not always go to the greater or stronger man. But soon or late, the man who wins is the man who thinks he can. आपको शर्म लग रहा होगा यहाँ आने में. कोई कुछ बोल दे, अच्छा नहीं बोले, गलती बोल दे. But आके बोलो, be bold. एक खराब बात बोल रहे हैं. बचपन में सीखा था, कुत्ता भौंकता हाथी चलता. Dogs will bark, but be like an elephant and come and do your work. पहले क्या होगा? अच्छा एक चीज और एक एग्जाम्पल दे रहे हैं. 1 minute please. Pond पे there are all leaves and all on the top, plants. आप घड़ा को जो डुबाओगे तो क्या घुसेगा पहले? लीव्स एंड प्लांट्स जो ऊपर है वो घुसेगा। डूब जाओ, डुबाओ उसको, फिर जब उठाओगे देखिएगा उसमें कोई प्लांट नहीं है, फ्रेश वाटर है। इनिशियली सबको गाली देगा, सब भी कमेंट करेगा, कोई काम नहीं करेगा, बट यू डू योर वर्क, slowly the essence will come and everybody will start respecting you. बैठे मत रहो, don't work for your family and children and your practice. Practice में पैसा आएगा. What will you do with the practice? You have 3 cars, 4 bungalows. You have many things. सोना तो एक ही खटिया पे है, एक कार में जाना है. Don't look into the money. The respect you get with money is a sham respect, not the real respect. The real respect is when the people will come and tell you. You will understand they are respecting you from the heart or not. So don't go after money. Money you need, that's all. But don't go after money. And be bold to face the truth and work for the truth. That is very important. Tell, what's your name?
Myself, Dr. Kritika Naik. I am a junior resident in Department of Dermatology and Venereology in IMS PHU. I want to say, sir, that as a resident, we are neonates in this world of dermatology. So obviously, whatever we see, whatever we learn, that we have started to learn now, seems very fascinating. But in this conference, we got to see that we got to present our work, and it was as keenly observed and heard by others as well, that is our seniors. So definitely the motto that together we learn, that is even our senior most faculty members were keenly observing and hearing what we were trying to say. So they are also learning and we are also learning, everybody is learning together in this, and this tells us that learning never ends. And also we were very happy that you chose Banaras in order to hold Aesthetica Asia here, and we got to present our work and also got to learn a lot in aesthetics. Thank you so much.
Thank you very much. Anybody else? Nobody. I'll request the final, the most beautiful lady present over here, Madam Barnard, to say something. After that, we have the award session. In the award session, we will give you a plaque, memento and a certificate. If your name is not in the certificate, wait and we will write the certificate and give it to you. Okay.
Hello everybody, and thank you also to be present here. I'm not a doctor, I'm the wife of Dr. Cambier, and for me it's always interesting to see the evolution of everything here, and to see that everything is going on, and every time we come here it's a nice success. We learned a lot of things together here, and I think also this place is very interesting. We were able to see the river in the evening together, so we will stay here 10 more days, and it will be an opportunity for us to discover more of your beautiful country, and this is already a good start of our stay here in your country. Thank you.
Thank you, Mr. Barnard. Now the award paper session, I would request Dr. Barnard to come up and distribute the award. They will be very happy. There were 10 people, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. one who got the third prize is Dr. Prachi Sharma. After that, we will have a group photo, of course. So please be around.
साइड से लो, हम कंटिन्यू चलेगा मेरा, अभी कंटिन्यू चल रहा है.
Thank you. And the second prize goes to Dr. Pragya Chaudhary. And the first prize goes to Dr. Shaknik Dey. Now, please, one by one, come forward. Dr. Ritika Khanna. All of you will get a certificate also, which is very important for you all. So these will go off, but the certificate will remain. Please, in a sheet, write your name, phone number and email. So it will be easier for us to reach you. Otherwise, if you don't get, that means you have not given, you have not given the name, phone number and email. Make sure that you make a list together and give it to us. Okay. Next is Dr. Kuldeep Singh. See, to clap, it doesn't take any money. You are encouraging your colleague. जोर से ताली बजाओ. Never be a confused in clapping. Next is Dr. Krutika Nayak. You just come up and help. It seems he's getting tired. Come and help, Dr. Bernard. Next is Dr. Nilanjana. Louder. The next one is Dr. Rishikesh Chandra. Now I should call Dr. Gargi Dhake. Dr. Gargi Dhake. And the last speaker for the awards session is Dr. Prakriti. There are two more to give for short paper session. One is Dr. Atul Mohan. And the next is Kamalpreet Kaur. I'll be here for a few minutes. You get to give your name, etc., and we'll print the certificates and give it to you. Print your name in the certificate. Certificates are there. So, I think the presentation is there, over. You do your duty in helping us to do our duty and send you the certificates. Anything you want to tell, any question or any problems? Please come over here, all of you. We'll have a group photograph. First, only the presenters come, all award session and short session. Wear your patta, that looks better.
एक फोटो उनको बीच में आ दो अजय फोटो उनको बीच में आ दो आप थोड़ी सी बात करो
कोई बाकी है जरा जो फिक्स हो रहा
हाँ एकदम Done, sir.
Thank you. Wait. Rest. Please come. Deepak, इसको हटाओ ना. पीछे कर दो. Crowded हो गया क्या? आ जाओ ना जैसे some people come to the right. Join. To the left. You can have more. Come.
आप लोग थोड़ा सा इधर आइए
हो जाएगा और
वो लोगों को शेयर करें पीछे से आप लोग
Come this side.
taller people stand behind आप भी आइए Ready? One second. Take. One more. Done.
Thank you. And thus we adjourn the valedictory. Thanks to all for your participation.
Regardez déjà pour le taxi. On va dire au revoir.
Sinon, je téléphone à l'hôtel.
Yes, sir.
ठीक है, और हो गया।
फिर अगर इधर आएंगे तो
चलिए, आपका नंबर है। हाँ,
मैं उठा के
नहीं बोलेगा इसको देना नहीं, आप खड़ा हो
अभी तो नहीं, आप बहुत बिजी होगा, आफ्टर 3-4 आवर्स
এটা তুলে দেবো।
वो आप डाउनलोड कर लीजिएगा।
थैंक यू। देना है ना, कैसा हो गया? हाँ, बंटी का जो भेजा उसको जो भी देना मेरे को उन लोग कहाँ फेंक दिया, कोई ठिकाना नहीं है। ओनली के लिए इसका कोई हाँ नंबर नहीं है। आप कैसा दीजिएगा मेरे को? 9493300622 RN दत्ता।
ट्रांसफर करते हो?
हाँ, RN दत्ता। नहीं, मेरे को बाई पोस्ट भेजिए, पैसे आपको देख तो पेन ड्राइव कभी दे दीजिए करीब।
पॉसिबल नहीं रहेगा कॉपी करने के लिए।
मैं कल दे दीजिए। हाँ, नहीं कल सवेरे में उधर हो यूनिवर्सिटी